Addiction recovery can be a difficult journey. If you or someone you know is seeking support, there are some incredible resources available at GROW, which is the Gibson Recovery Optimizing Wellness. Here today representing the team at Gibson Area Hospital's Addiction Recovery Services are Ashley McCulsick and Sue Emberson. Ashley and Sue, welcome.
Thank you.
Thank you.
So tell me a little bit about the work you guys are doing in Gibson City.
Currently, right now, we are addressing addiction med behaviors and other problematic things that we are trying to work on with patient care. But basically, we are developing a team approach, not only in a family practice setting, but also to address substance use.
So substance abuse, I mean, that's a difficult topic and one that I think a lot of folks don't want to discuss or be aware of. And you guys actually try to work with the whole family, is that correct?
Absolutely. We do work hard on kind of addressing the bias that's attached with addiction recovery. And we also work on a lot of the stigma and trying to reduce that, not only with community, but definitely in friends and family.
Mm-hmm.
Yeah, so tell me a little bit about your approach. How do you guys approach addiction recovery?
Well, like she said, for the whole person. So I am actually a therapist at GROW specifically. They have other therapists at Gibson Hospital, but my position is specifically with GROW. And so we do it with myself, and then also we have two wonderful nurses that we have. We have Dr. Osman and then Emily Quaid, who both are providers for that, for the family health portion of it as well as the addiction med portion of it. And so by doing that, we're able to kind of look at the whole person and help with all of those different kinds of things. We're also able to then pull in their families as well and kind of work with them to kind of bring them into the loop.
That's cool. So now you guys have something, is it called Smart Recovery?
Mm-hmm.
Tell me about that.
So we started Smart Recovery, and Smart is really, it's a management more of kind of addressing not only the addictive behaviors, but as well.
So those tools and resources for the patients as a whole, and we do that through evidence-based treatment models, just different coping skills that we have. And then we also have Friends and Family on the second Monday of every month, and that is from 6 to 7. But there's a couple different Smart Recovery groups for the addiction, people who are suffering from addiction as well, and those are in Mahomet on Mondays from 6 to 7, correct?
That's correct.
And then Paxton every other Thursday from 6 to 7, and then there's one in Gibson on Tuesdays from 5:30 to 6:30.
Now I know we're talking about Smart Recovery, but there's some other things that that are like services that you guys provide and approach. I think we have a graphic for that if we want to throw that up. It looks like you guys do is it called MOUD? Am I saying that correctly? Medications for opioid use disorder?
It's MOUD.
MOUD, okay,
yeah,
so you don't have to pronounce it.
Right,
MOUD.
MOUD, and medications for opioid use disorder. But that's not all we address. We don't just
yeah, I see you guys also do treatment for substance use disorder and other problematic behaviors. What other kinds of things do you guys see that you guys work on treating?
We do a lot of gaming, a lot of texting. We do a lot of...
So you're saying like technology addiction?
Absolutely.
And do you see that a lot in adults and kids? Or?
Both.
Okay.
Both.
And so that I've been hearing that's a growing problem just with the way things are going these days. Is that you know, something that has become more of a problem since COVID?
I think COVID probably spurred it a little bit. I think it was already there and kind of developing, but definitely COVID did put us kind of back into that isolation that more people were gaming or more people were texting.
Now, last thing, if somebody does need help, what's the first step? What should they do?
Call our office.
Call your office.
Yeah, we're welcoming. You know, our whole group, we work hard to welcome everybody, make you feel comfortable, not feel judged, or, you know, there's no stigma attached to getting help. There's no stigma attached to going in to have your blood pressure checked, and there's no stigma attached to getting help for any kind of substance use.
That is fantastic. We are all out of time, but there is more information on their website. If you'd like to get more information about the services provided by GROW, you can visit their website. We'll connect you on our website at ciliving.tv.